Welcome, everybody. Today is July 28th, 2021. I'm Trey Dobson, Chief Medical Officer at Southwestern Vermont Medical Center and an emergency medicine physician with Dartmouth-Hitchcock Health. And this is Medical Matters Weekly. It's a show about the aspects of healthcare that matter to you most. And my guest today is Dara Zink, who is a board member for the Project Against Violent Encounters, also known as PAVE. It's an anti-domestic violence organization in Bennington. Really quickly, a little background on Dara, and then we'll get into this discussion that I'm really excited about today. By the way, Dara, did you know that my wife was actually a board member a while back? Did you know her?
Oh, I did not know her.
Yeah,
but that's wonderful.
And of course, being an emergency physician, we are so thankful for all of PAVE's efforts and interact with PAVE. So Dara is a former outreach advocate and volunteer coordinator for PAVE, received a bachelor's degree in geology. So I have a bachelor's degree in geology myself, so I'm so excited to talk geology with you, but maybe we'll do that offline. From Castleton State College, and works as in the central office manager for the Bennington Valley Supervisory Union. And which is where you are today, is that right?
Yes, that is. I'm actually up in the high school today.
And then the most exciting thing on your bio is Roadrunners of America running coach. Well, tell us what that's about.
So I am a certified running coach through Roadrunners Club of America. They spread all over the U.S. We have coaches from East Coast to West Coast. And so we are here to help you meet your running needs.
Oh, that's great. And how'd you get into that? Are you just a runner at heart? And
so I kind of came around it. I come from a martial arts background, and then I played rugby for several years in college and then outside of college. And my body started taking a beating, and I said, I need to do something else. And so I picked up running and fell in love with it and got involved with Bennington Valley Runners, and that led me to Roadrunners Club. And I just decided to take it to the next step and coach road running as well. So
I imagine, I don't even know you, Dara. Now I'm getting to know you. You're probably one of those people that does more before 9 a.m. than most of us do all day, which is fantastic. So what brought you into the work of supporting survivors of domestic violence?
So because of my background in athletics and the martial arts, I feel pretty comfortable moving through the world. And I wanted to bring that comfort to other women as well. Mm-hmm. And so when I was looking for like a next career path for that, kind of to intertwine all of those interests together, I started doing some research, and I found out that women are actually harmed more often by those that they love and that they know. And so that research led me to PAVE and doing the work of, ending violence that way through supporting survivors, doing prevention work. And so that's how I came to PAVE. It just fit into my worldview and how I wanted to move forward and, serve people.
So you've been on both some of the management aspect and on the board as well, is that right?
So I managed the volunteers when I was there, and I did the outreach in the community. And then when I had to move on into a different position outside of PAVE, I just missed it so much, and I feel so strongly about their mission and their vision, and I wanted to somehow contribute and give back. I do believe in serving my community wholeheartedly, and this was a way that I could do that. So I joined the board to fulfill that.
That's fantastic. I know a lot of our audience hasn't really even heard of PAVE, or at least is not familiar with what PAVE does. So I want to get into that in just a minute, but let's just go back a little bit to the scope of the problem. Can you just talk to us a little bit? You said you were interested in helping because you found out information. Tell us about the scope of the problem, and you can talk about it locally, nationally, whatever you're most comfortable doing.
So we know that nationally, it's 1 in 3 women and 1 in 4 men have been in abusive relationships. And that's everything, that covers the gamut of emotional abuse to physical abuse to financial abuse to reproductive coercion. So there's a lot of different forms that this can take. Mm-hmm. And it affects everyone, regardless of your status, financial status, or, what job you have or anything like that. This can happen to anyone. And, so it is something that we face. And I think that, just bringing that into the public,
Sure.
making it's something that's very well hidden too. This is not something that, people walk around and they say, oh, I'm in this horrible relationship and, somebody help me. That's not usually how this happens. Usually it's very well hidden. What happens behind closed doors stays behind closed doors. In some cases, some people may not even recognize how unhealthy that relationship is, be it that this is how they grew up. It's just normalized for them. And, so it is prevalent. It's not spoken about. And I think that the work that we do at PAVE to spread the word about it, to make our services known so that we can help people and we can end this cycle of violence that happens over and over.
Right. And I think, many of us, we think about the physical assault, but you've talked about other aspects beyond physical assault, the coercion. And then I can also imagine that that's so hidden that we don't recognize it. Even in healthcare, when we have patients, it's hard to recognize. We try, and we've received a lot more training over the past, really 20 years, but even over the past 10 years to try to identify these situations. How do you talked about outreach, Dara, that you used to do a lot of outreach, and now on the board you do a lot of outreach. I imagine that's really difficult. You can't just go knocking on people's doors and ask them if they are being abused. So what tactics are you using?
So we train our local partners in domestic violence, just awareness. So what does it look like? What does it sound like when you're meeting with someone? I know that I've met with a couple of doctors to kind of talk about that, so that when they are in the office having a conversation with their clients or their patients, they, maybe somebody says something and they say, oh, well, that sounds like emotional abuse. Like, to have that conversation about, wow, that's not a healthy relationship, or that doesn't sound like it's something that you want, and to start that conversation and then help them steer in the right direction. So we don't expect a doctor, a GP, to be able to diagnose like brain cancer, right? And get really specific in what that is. So we don't expect them to be able to diagnose domestic violence necessarily, but in order to help that person and maybe direct them to our services, so that we can then, talk to them about their different needs, because almost every survivor is going to have different needs. Everybody's life is a little different. Where they are in their life is a little different. So we can really work with them to meet their specific needs, to help them, move on to the next part of their life.
So I'll put you on the spot a little bit here with some of those. I exactly, of course, agree, but understand what you mean. There's not a typical case. So if I said, describe a typical case, you would look at me and say, well, there's so many variables in this person's life. But how about giving just a couple of examples of course, made up situations, so the audience can get a feel of what you're talking about? Because again, I think most of what many of us think about is simply just the physical abuse without the emotional component.
Right. So, and a lot of times when you speak to survivors, right, they'll say that the worst part of it wasn't the physical abuse. So once they're out of the relationship, they look back and they say what they're struggling most with is the emotional side of that, the degradation, the harm to their self-esteem, and things like that. And then coming back from that and finding themselves can be very, very difficult. Another thing that we see is financial abuse, where the victim, and now remember, we can talk about men and women in this situation.
Sure.
It is, a fact that this happens more commonly to women that we know about. Women will speak up a little bit more often than men will. But so when I refer to, a victim being a woman, it's just because of that.
Yes.
But it can happen to men. So when the financial abuse side of it is that the victim doesn't have access to funds. Maybe the victim is actively working, but the perpetrator takes the paychecks and controls the money. And that could be that they're spending it on who knows what, but the victim is left without anything. So that often happens in financial coercion. So when they try to leave, they don't have any resources to leave. They have no money. They can't afford housing. They can't afford food. If there are children involved, they can't support the children. And so a lot of times they end up staying because of that. So we see that. We see the financial abuse as well. And then the reproductive coercion is something that has been discussed about, over maybe the last 5 to 10 years. It's kind of come more to the forefront where one partner forces or coerces their other partner into having children. Right, against their will. There could be birth control contamination, could be you don't allow them to have birth control, during intercourse, maybe they remove the condom, things like that. And then the other party gets pregnant, or, if it's the female doing the reproductive coercion, maybe she stops taking her medication, her birth control, and then she gets pregnant, and then you're tied together now. You have a child together. This is right. So power and control. And this is how you control someone. You control the child, you control the parent. And so now, and that's just something that's, becoming more and more talked about over the last several years.
And that's what you're talking about. The essence is that power relationship. It's not just a physical assault. And I keep going back to that again, because that is what people envision when they think about domestic violence in that regard. And so PAVE addresses the entire component of that. But really quick, before I do want to get into what PAVE does specifically, and how to get in touch with PAVE and refer people. But before we go into that, let's talk a little bit about the stigma, not only of the person being in this situation, but what you hear about a lot in the public is that person is asking for it, or they could have gotten out of the situation. And what you're describing is a trap, and where it's impossible to get out of that situation. Does PAVE try to work on that as far as the stigma in the community?
Yeah, so we do. We talk about that, because there is a lot of that. Why didn't they just leave? Right. Why don't you just walk away? Why don't you just, how hard is it to walk out the door? It is so hard to just leave because of some of the things that we've talked about, right? So there may be a situation where the person doesn't have the funds to leave. There's also threats of violence, threats of harm, not only to the partner, but potentially the partner's children. We've seen it where they'll threaten to harm pets. If you go, when you come back, the dog will be gone. Threats like that. If you go, I will find you. And actually, the victims are at the highest risk of harm when they leave. So for some, it's not a solution. Right. It's actually putting them in greater danger where they can manage their abuser. If they're with their abuser, they know the abuser, their moods, they know what's happening. They have probably lived with this person for years, right? And they've learned to manage that person. They've learned to manage that situation. And when they leave, they aren't there to manage that anymore. So that becomes very scary. Now they can't read that person. They don't know what to expect. And they don't know what that person's doing now. It's very scary. And
what you're alluding to there, or describing actually there, are all those external barriers. And there's the internal barriers. It's self-esteem, just the fear in general. And then the aspects you talked about, the financial, being tied together financially, or because of children, making it in people's minds impossible to leave. And so that's where PAVE steps in a little bit here. So let's talk a little bit about what PAVE provides, and then how people in the community can help not only PAVE, but identify people and refer them. So tell me a little bit about what PAVE provides.
So we are now in our 40th year, and we are super excited. This is our 40th anniversary year. So you'll be seeing more from us, with our ask from the community for this year. And we'll talk about that more a little bit later towards the end. But our services, our backbone of our services is our 24-hour hotline. And that is accessible, like I said, 24 hours a day, 7 days a week. That is staffed almost exclusively by volunteers. And so you can reach out, you speak to a volunteer. We do everything from filing relief from abuse orders, called restraining orders, or protection orders. We can help with that if you choose. We can just do basic emotional support if you just need someone to talk to and talk about your different options. Like we said, everybody's situation is different. And so talking through all of the different options that are available to you. So that's what our volunteers do. We work hand in hand with the hospital. So you guys, in the emergency room, we will come and we will meet with clients, people who have maybe been sexually assaulted, and they are going through the sexual assault nurse exam. If they've decided that they would like to do that, we will come and we will sit with you while you go through that process. We hold hands, we emotionally support you, and we talk to you about all of your options through that process. And oh my goodness, we do so much. So we do shelter, right? So we, the volunteers can work with getting people into emergency shelter that night, which we know has become very difficult through the pandemic.
Sure.
A lot of our shelter space was taken up. So we were struggling with that process, getting people into shelter, but that is something that we do. The volunteers do emergency shelter, and then the staff itself will then take over. And if they need to move into a more longer term shelter, we do that through the staff. So we touch a little bit on everything. We help guide people. If it's not something that we do internally in-house at PAVE, we will make sure that we refer out. We connect people directly to referral agencies. So, UCS for mental health. We connect to the hospital. Right. We go back and forth if we need that. We connect with the CAC as well. If there are, children involved, we can connect to the CAC if our client would like to be connected there. And everything is confidential. So PAVE is 100% confidential. What is told to us stays with us. It doesn't go anywhere. Unless you want to be referred out, in which case we're then authorized to go ahead and connect you with our local agencies.
I imagine you have, for the audience, you may think, someone contacts PAVE and it's a one and done thing and it's over with. And I imagine that's not really the case with many of your clients. I'm sure you develop a relationship at least over a short amount of time, because this is not some decision they just make one day and say, oh, okay, I need help. I'm going to get out of this situation.
So sometimes we have people call and they just want information. Sometimes they just need confirmation of what they're going through. Is this as bad as I think it is? Believe it or not, some people doubt themselves. And, they've been put into situations where they gaslighting, right? So now they're questioning a lot of what is happening in their lives. And so we do get calls where we're just confirming, yes, this is what's happening to you. You are valid. And they take that and they may think about it and they, may come back with more questions. We can work with people from one time, like you said, to over a year, 2 years. As we help them transition into, the next phase of their life, as we help them move beyond that and really become thrivers.
Well, they've had so much emotional abuse, many of them, that their confidence is shaken, their self-esteem is gone. And like you said, they may not even recognize anymore what is appropriate behavior and what is not appropriate behavior towards them and treating them as humans. So you talked a little bit about the pandemic. I don't want to go too much about the pandemic, but I know that you have functioned 100% through the pandemic. So thank you. And I know that just from being in the emergency department. Are you still able to shelter people today? Is it going okay?
Yes. Yep. So we are able to shelter people. Fortunately, it seems we want everybody in shelter. But what happened when that happened is that our clients, we were really struggling to place in shelter.
Right.
And it becomes very hard for our clients because if we can't shelter them here in town, we have to shelter them outside of our county. When that happens, unfortunately, a lot of people don't want to go that far. They lose their support services here. They lose, things like that. Maybe their family is here. Maybe they need that. The kids' school, right? A lot of kids are in school here and they don't want to uproot their children. And so they make the decision instead of going into shelter to stay where they are.
Right.
Because they're losing that support.
Let's talk about, you mentioned that it's the 40th anniversary and you're going to be increasing some outreach. What are some of the more pressing needs, not only of PAVE, but just in the anti-domestic violence space that we have?
So obviously funds, right? I think in our line of work, we're definitely seeing a crunch on our funding. There was some issues with VAWA being passed again. So we are going to see a crunch coming through for our funding. So, with any nonprofit, right, we want to keep our doors open. We want to be able to support our clients. So definitely funding is going to be a huge part of that. And I think another thing that we really need to focus on is prevention work. And we do have Mike Dryblatt does our prevention work within the schools. And so he goes out to our area schools and he goes in and he does anti-violence work and he does anti-bullying work to really try to move upstream of the problem and stop it before it happens.
Absolutely. But I think that is so important. I don't want to mean to interrupt you and I want you to keep going, but it's something that in all of healthcare, and I consider this part of healthcare and our own well-being, we've got to get on top of, and it does work. There's a group of people that doubt some of these activities in schools and among young folks, and it really does help prevent, it doesn't eliminate, but it helps prevent people from becoming violent, being the aggressor, when they start understanding at a young age that it's really not appropriate. And it's, we think they should know that already, but sometimes they don't have the upbringing to understand that, or of course they are in a situation themselves that is a violent household. So how can we help in fundraising? Do you have a website?
We do. It's pavebennington.org. And that also has all of our contact information. That has our hotline number. Can all be found there at the website. We will be rolling out a raffle in September. So look for information coming out about some amazing gift baskets that you can win through that raffle. And then we'll also be debuting our new video that we are currently working on that talks about our services and how we've been doing this work for 40 years. So we're
What about folks that want to get involved but aren't necessarily in a position to give monetarily? What about volunteer time?
So, oh my gosh, yes, volunteers. We love our volunteers. You can reach out to Outreach Advocate at pavebennington.com. And that is now our new volunteer coordinator, Sarah. And she can work with people to decide whether or not the hotline is right for you, or if there are other ways to volunteer with the organization. So that's probably the best route to go for that.
That's great. And they can get those links from your website, correct?
Yes. Yep.
That's awesome. So before we end here, let's just go into a little different area, and that is the person who is worried about a friend or a family member. It can be a situation that's very uncomfortable. They don't even know how they can approach the individual, or maybe they have. What advice would you give them? And I'm sure you see this situation often.
So you can always call our hotline 24/7. We will also serve you if you're concerned about somebody else's situation, and we can talk you through how to interact with them, how to talk with them. The biggest thing to keep in mind is support. They may not be ready to hear it yet. They may not be at that point, where they're even ready to accept that that's the type of relationship they're in.
Mm-hmm.
And so sometimes just being there for them, letting them talk to you about it. That's, you can say to them over and over and over again, right? That, like, this isn't healthy, but they're not going to hear it until they're ready. And so while it may be frustrating for you as a friend or as a loved one to this person, being that consistent ear and that shoulder for them, and then someday, hopefully, they'll be, oh, now I see it. Now I'm ready. But you can't force them. You cannot force anyone to do anything. So
you can be aware, you can listen, and you can refer them. Dara, how many family members roughly, or how many people? I'm sure you follow some type of statistic to reflect your work. What numbers can you give us?
So we are currently, for the 1920 year, we serve 583 clients.
Wow.
And we also serve clients in our supervised visitation group, which is called Family Time. And so we served 59 families in that year with in-service supervised visit, in-person supervised visits. And that was even during COVID. So if we hadn't been faced with the pandemic, there would have been even more, 59. So.
Well, I mean, it's such admirable work, Dara, for you and your entire organization. We are all thankful. Those numbers are both positive in the sense of all the work you're doing and getting to reach out to people, and also negative in the sense that there's that many people out there suffering. So thank you again for all you do. Using in the emergency department, recognizing a situation and contacting PAVE. Many places don't have access to resources like this, and this is what makes our community and our volunteer not-for-profit organizations so exceptional. So if you are looking to help volunteer or to donate, PAVE is an excellent organization, as well as many in Bennington, focused on the well-being of individuals through not-for-profit work. Thank you for coming, Dara. This was excellent. I look forward to continuing to be in touch and having you or one of your colleagues back on the show in about a year to just keep the message going. I also want to thank CAT TV, Ray Smith from Southwestern Vermont Healthcare, and Ashley Jowett from Southwestern Vermont Healthcare, who helped make this show possible. Next week, we will have Dr. Alia Reeve of United Counseling Services in Bennington to discuss some of the community's mental health needs. And you can send your questions to wellness@svhealthcare.org in advance. I'm Trey Dobson. Go out and find joy in everything you do, even in the face of adversity, and we will see you guys next week.